I call Jenny Salisa.
Mr Chair, Vote Health needed an additional $635 million just to keep up with demographics and inflation. It did not get that in this budget. Primary care was only increased by $6 million. It needed up to $26 million. The increase to Pharmac is less than half of the $103 million it needed just to maintain 2009 to 2010 expenditure levels. This means, Mr Chair, that Kiwis will continue to miss out on effective life-saving drugs that are funded in Australia and other countries. The national government has effectively cut around $1.7 billion out of the health budget over the last few years, Mr Chair. And it has not even had enough funds to have enough to meet enough of the health services and the cost pressures, let alone backfill the cuts that they have made. But, Mr Chair, there is only so much that DHBs can do and only so much cuts that our health providers can take. There is nothing more to cut. There is only core health services now to be cut, and we would prefer that this current government does not do that. In 2016-2017, DHBs will be expected to make even more cuts in terms of efficiencies as they absorb record amounts of wage, demographic, inflation and cost pressures. As the Minister of Health, Mr Coleman, himself said last month, this government refuses to fund district health boards to meet demand for health services. Mr Chair, a Labor government and a Labor budget would invest in health. We are committed to meeting population and inflation cost pressures and reversing the national government's spending cuts. Now, I listened very carefully to Honourable Peseta Sam Latuinga's contribution, and one of the things he said, or he challenged this side of the House, was name one bright idea. Well, I would like to say that one of the things that we as a health system should be worried about and should actually have initiatives to address is the fact that non-communicable diseases, NCDs, is really something that we should address. Now, New Zealand, as a country, we have the third highest obesity rate in the world, second to Mexico and the United States. This is not something that we should be proud of, Mr Speaker, and as a Tongan and as a Pacific Islander, I am most definitely not proud of the fact that Pacific countries, they have the highest rate of NCDs in the world. As a Tongan, I'm also not proud of the fact that Tongans as a people, we are the most obese in the world. Now, Tongans and Pacific aside, New Zealand also has a big issue with obesity. Now, the University of Auckland, way back in 2012, they did a study and they told us that their estimate is that it currently costs New Zealand right now between $722 million and $849 million a year in healthcare costs and lost productivity. Now, the bright idea in terms of the challenge that Honourable Sam Latuinga threw at this side of the House, I would say that one of the things that we as a Labor government are really good at is we look forward, and we usually are a government that has a long-term view. We have a strategic approach to health, to education, to housing, as well as social security.
You should try it with politics as well.
Now, in terms of just back to health, Honourable Minister, when we were in government, we realised that obesity was going to be a big issue long term. We put aside various initiatives to address obesity. We had various initiatives, Mr David Bennett, we had various initiatives to tackle obesity. We had healthy eating, healthy action programs, we had fruit in schools, we had health promotion in schools, we had community actions, and we had various things in terms of tuck shops in schools where we would not allow various foods and sugary drinks to be sold in schools. Now, look back 8 years, David Bennett. How has the obesity level in New Zealand fared? How has child obesity levels in New Zealand fared? It has increased, Mr Bennett, and it has increased, Mr Bennett, under the watch of your current government, the national government, which actually came through and cut all of those things that we put in place because we could see into the future that obesity is something that will overtake the current costs. It would actually overtake tobacco. So when you challenge us, Mr. Chair, we have a lot of ideas.
I call Barbara